So this is a liposuction case about a patient who never had any children, who is on the younger side, who has gained about 20 pounds over the last 3 years, and she wanted to get rid of some of the problem areas. And in her, it is about general sort of abdomen. And so she has some fat deposits on the upper and lower part of the abdomen, and her waistline, which she had, is now a little bit blunted. And so what we wanted to do was we want to make sure that we actually accentuate that waistline. And then in terms of the abdomen, we wanted to make the abdomen as flat as possible. The other thing with this patient is that she wanted her legs to be more straighter. And certainly her leg doesn't look bad, but she did have some fat deposit in the inner aspect of the thighs. But the other thing that sometimes gets kind of overlooked is the importance of fat deposition along the medial knee area, because that area does account sometimes for non-straight inner portion of the leg. And so these are the areas that we kind of focused on in terms of the liposuction to achieve a more straighter after effect. The type of liposuction that we performed on this patient was what we call body tight procedure. Now, body tight just means utilizing a certain energy. And these days, when we do liposuction, we never just do straight liposuction alone. We feel like the fat comes out better when you use certain energy to melt the fat first. And then also, by utilizing the energy that melts the fat, it also tightens the skin too. And so these days, there are 3 different types of energies that we use for this effect. The first is using radiofrequency, which is the body tight procedure. So radiofrequency energy we utilize to melt the fat as well as tighten the skin. The other type of energies are using laser wavelength to melt the fat and also tighten the skin, and that's called smart lipo. And then the third type of energy is called the ultrasound. So with ultrasound, it is called vaser liposuction. So these are the 3 choices that we currently have on the market that's available to utilize. The radiofrequency energy is the more newer type of modality, and we feel like we accomplish a little bit more with that in our practice.